Yeah,
the
so
question?
just tell us about yourself and your role at CHOC and kind of what gravitated you towards the mental health department.
Okay, so currently I am the interim manager here at CHOC Hospital. We had our manager just recently. She moved on, and so they needed another manager. So when we started back in 2018, when the unit opened up, I was charge nurse on the unit. I also was a trainer in CCM, which is Comprehensive Crisis Management. That's where we train staff to how to de-escalate patients that are in crisis, and then we also teach them how to safely protect themselves. Um, so I did that training along with being the charge nurse. So I was here for over 2 years, a little over 2 years, and then that's when they named me the interim manager. I've recently applied, and so I'm really hoping to get the job as the actual manager in the unit. Um, yeah. So what got me into mental health? I I if you My story is that after I had my daughter back when I was younger with my wife, we couldn't have any more children after that. And we were fine with that. We had one perfect little girl and we were very content. But then my daughter started asking for siblings. She really wanted to have siblings. She started doing her own research at the age of 10, found out that you could adopt through foster care, because I'd always said, oh, it's too expensive, we can't adopt. And then she said, no, 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 Dad, look, if you adopt through foster care, they pay you. So she did all her research. She did all her research. One thing led to another. I always say my 10-year-old daughter and God convinced me and my wife to go into adoption. We eventually ended up adopting a total of 5 children out of foster care. So I have my biological daughter, and then I have 5 children out of foster care. And when our kids came through foster care, they had a lot of trauma and a lot of issues, that things that they faced, and we had to go to different therapies, multiple therapies throughout the week. And I just really started to gain this kind of like passion and understanding for the need the need for pediatric mental health services that really weren't available. I ended up getting hired at CHOC. For almost 5 years ago, I got hired here at CHOC, but I got hired on the medical unit. And I remember when I came into the fellowship program that I was involved in order to get prepared to work as a pediatric nurse, they were talking about opening up this mental health unit. And when I heard about that, it was like this kind of spark went off inside of me. It was almost like fireworks were exploding inside of me. And I knew that's where I was meant to be. So over the next couple years, I harassed and hounded everybody. It's kind of funny because people that I work with now, like the psychiatrists and the psychologists and all them, I hounded them for so long trying to get all the information that I could. And they go back and tell funny stories about this guy covered in tattoos, because I got lots of tattoos, like approaching them in hallways and in elevators, trying to get information. But man, I was just totally sold out on the idea and just wanted to support the dream of this unit from the very beginning. So that's what really got me interested in mental health. And what is really wild, is that I got hired right off the bat, became a charge nurse, and here I am today, and the dream still lives.
Yeah, beautiful story. Thanks, man.
No problem.
So yeah, how are your kids doing today? Like these days, everyone's good? Everyone's
Oh yeah.
yeah,
Like the COVID stuff
yeah,
and online learning and all that stuff,
yeah, yeah.
has been a challenge, to say
I
the
bet.
least.
I bet.
I mean, my kids, my daughter is 20, but then I've got a 14, a 13, and then 3 11-year-olds. So
Okay.
the
Wow.
14, the 13, and the 3 11s, we just have them
Yeah.
staggered all over the house online. You have to walk behind them, make sure they're doing it, because my son, he got the bright idea of just snapping a screenshot and putting it on Zoom.
Whoa,
Yeah.
that's
Oh.
Yeah, then we get a call from his teachers telling us, like,
he's not. Yeah.
Yeah, he's not responding when they're asking
Oh.
questions.
Smart kid.
Yeah,
It's funny.
there's a little bit of respect there, but at the same time, it's been very, very stressful. It's
Yeah.
been really hard on my children to see their peers and their friends and their classmates on a Zoom class, but
Yeah.
not be able to actually talk or interact with them. That's been one of the
Yeah.
big stressors
Yeah,
that
I
they've had to
bet.
face.
I think
Mhm.
that's one thing is like human connection is definitely very important for kids, right? You know, like just being able to like talk and, I mean, I don't know, like
Socialize.
socialize, play
Mhm.
basketball with your friends or do something with your friends, right? That you normally would do in school, but then now it's like you're confined, and then I can't imagine like kids going through like COVID right now this year, being locked down and not being able to like really roam freely, right? You know, and see people. So
And so that's really has contributed a lot to I like to say like basically a mental health crisis that's happening and going on right now as we speak,
yeah,
Mhm.
especially among children and the pediatric population. Um, you know, like when we talk about being on the front lines, we think about the emergency rooms, the ICUs, but rarely do we actually think about what's going on in mental health units right now,
yeah,
and
Right.
especially pediatric mental health units. We've seen such a rise in suicide. Like, and what I mean is like we have the acuity of our patients is at another level. Where before COVID, we would have uh, children come into the emergency room because maybe they told their school counselor or their teacher that they were thinking about killing themselves, right? So then they call the CAT team, which is the county assessment team, to come out and assess the child. The child ends up in our emergency room. They end up on our unit. They're thinking about it. We've gotten ahead of it, right? And so now we're able to implement our our therapies and all the things that we do, our interventions. But now what we're getting is we're getting kids that have taken like 2 bottles of ibuprofen and like Xanax and or two whatever. Like they've taken like all these wild medications, you know, with alcohol and or they're like, you know, where before the patient might be thinking like, you know, well, I think I'll kill myself by hanging myself. We're having people walk in on them in the midst of the action. You know, this is the difference that we've seen since COVID has hit. And so our acuity is much higher, which means that our kids are staying longer. So they're here on our unit longer than they typically have been in the past. And then there's just so many more. Our unit has 18 beds. Currently in the hospital, we've got about 16 kids in the hospital waiting for a bed in the county. And there's just not a bed in the county to put them in. And then we've got like, I'd say 15 to 20 on the county wait list in other emergency rooms trying to find beds right now. It's a crisis that we're in, and we don't really have the beds and the staff and the units to really care like we should for these patients. And then
that's
on top of that, a lot of our kids have COVID.
yeah,
And
my goodness, yeah,
not very
yeah.
many mental health units want to have a COVID patient on the unit. Thankfully, we have embraced it finally. We're like, this ain't going away. We got to care for these kids. And so we're making accommodations on our unit to take COVID positive kids.
Wow.
Wow.
That's amazing.
Yeah, it's definitely tough. Like, man, but then like now it's like, you know, like since COVID, it's actually pushing the limits of like healthcare to its max, right? Not only
Yep.
just kind of like emergency room, like, you know, like accidents and physical trauma, but also like mental health, which is basically pushed into the front lines. Hopefully, like people are like really like becoming aware, like, oh shoot, this is really some deep crap that we're in, but we never really kind of have a solution for a lot of these things. We're still playing by ear, but now it's like, okay, our healthcare systems definitely needs to basically shape up, you know, after all this, right?
Yeah, we absolutely got to figure things out. Like, just for an example, in the emergency room, their average length of stay for a patient is usually
Mm-hmm.
2 to 6 hours. So think about that. A kid comes in with a broken arm, 2 to 6 hours, they're either sent out or they're sent up to the floor, whatever that looks like. A mental health patient coming into the emergency room can stay there from anywhere from 3 to like 12 days. So right now, I think we have like 8 patients, or it's anywhere between 5 and 8 patients in our emergency room. Those are 8 beds that could be used for trauma, could be used for a lot of other things, but there's nowhere for these kids to go. So absolutely, we really do need to rethink this, because it is, like you said, it's drying up our resources.
Okay. Man, I can only imagine, like, but then, because then, like, you know, you're working at the hospitals, you see everything firsthand, right? You see how packed and, you know, like, everything is over capacity, and like what you guys are able to do for kids and what you can do, but then you're not able to do, right? It's like, but then, like, what is the next step, you think? You know, I know you don't have like all the answers for everything, but then, like, what do you think would be like the perfect like scenario? What's the first step in trying to fix a lot of these things, you know, from your understanding and what you think might be the answer, or at least some of the answers?
I have some thoughts on it. You know, obviously I don't have all the answers, because it's such a overarching issue
Yeah.
that it's going to take a lot of people working together to actually
Yeah.
find a solution.
Mm-hmm.
But you know, some of my thoughts, and as far as some of my dreams that I have, is uh, like like a mental health, like if CHOC were to have like its standalone mental health hospital with its
Mm-hmm.
own mental health emergency room, with multiple departments and divisions, uh, you know, to where we could really cater to the need that's out in our community. I think that number one, the first thing is just awareness, and it's the
Mm-hmm.
awareness of the vast need. You know, I think, you know, I can't remember the exact statistic, but I think they said it was like enough children in Orange County to fill up Angel Stadium 2 times.
Mm-hmm.
That's how many kids that face mental health issues in our county. And if that's true, then we need a lot of resources. We need a lot of awareness of this need. And we really need to step up and work to try to meet the need. I really do feel like we keep talking about this um, amongst our staff and everything, but we really do feel like in mental health, this is kind of our time to shine. It's our time to just really make people aware, to help meet the needs that are going on in our communities. And you got to believe it. Everybody here, I can only speak for our unit here at CHOC Hospital, the Mental Health Inpatient Center here. Everyone here is passionate about seeing these kids get better. I mean, this isn't just a job to us.
Mm-hmm.
This is many of us feel like this is our calling. It's our calling to be here and to be available and to be here now when these kids are going through such a hard time.
Yeah, I can definitely feel that. Like just speaking to the three of you today, like, you
Mhm.
guys are definitely very passionate, and it like, you know, makes us tear up a little, like you guys are doing such
Yeah.
great things. So,
Well,
yeah,
thank you
thanks for
very much.
sharing.
Thank you.
Yeah. Yeah. I think you guys should just kind of like go on like conference, yeah, you know, like talks, you know, to like other like departments all around the world, like the other healthcare providers at mental health department. You guys should just be the ones talking to them and giving them speeches, you know, telling,
That
you
was
know,
actually something I thought about the other day. It was like,
yeah,
how do we get in front of other people to get them, you
Mm-hmm.
know, like I said, to drink the Kool-Aid, you know, like
yeah,
this is good work that we're doing, and it might be different from what you've seen, but we're just seeing such positive results.
yeah, yeah. So maybe hopefully one day you guys can have your CHOC inpatient like mental health department tour. You guys go around the country and nation
There
and
you
talking, you
go.
know, right?
Yeah, man. I
You
love
know?
that. I love that.
Yeah, yeah. So culture is definitely one thing though. That's the main thing. You guys have the culture, you guys have the same vision, you guys have the same goals. I think
Mm-hmm.
that's the most important thing. You guys are all like basically all on the same ship, and you guys are basically sailing towards the same path. I think
Mhm.
everybody like elsewhere, like you can't speak for all the other hospitals and departments working with mental health patients. I think most importantly is just education and getting people excited about what they're doing, you know, and about helping human beings and showing kindness at the same time and understanding.
And you know, that's our philosophy, is that we treat every patient that walks through that door with dignity, respect,
Mm-hmm.
with kindness. Uh, that we take the time to create those therapeutic relationships. That if it takes 15 minutes, if it takes 3-4 days, you know, we're going to take the time that's necessary to create those therapeutic relationships and have breakthrough. Our philosophy is that every patient that comes onto our unit, we treat with what we call trauma-informed care. We assume that they've had trauma, so we're doing our best not to trigger or like to reactivate that trauma, but instead we want to be a source of healing. And so that honestly, in a nutshell, that's it.